Ryan Reynolds here from Mint Mobile. With the price of just about everything going up during inflation, we thought we'd bring our prices down. So to help us, we brought in a reverse auctioneer, which is apparently a thing.
Mint Mobile Unlimited Premium Wireless. How to get 30, 30, how to get 30, how to get 20, 20, 20, how to get 20, 20, how to get 15, 15, 15, 15, just $15 a month? Sold!
Give it a try at mintmobile.com/switch.
$45 up front for 3 months plus taxes and fees. Promo rate for new customers for limited time. Unlimited more than 40 gigabytes per month. Slows full terms at mintmobile.com.
Host the ultimate backyard barbecue with Whole Foods Market. It's the hot grill summer event through July 16th with sizzling sales on no antibiotics ever boneless beef ribeye steak and beef New York strip steak. Plus, check out sales on sustainable wild-caught Alaska sockeye salmon, organic strawberries, and more. In a hurry? Choose grab-and-go favorites like picnic salads and sushi, plus plenty of cooler-friendly beverages. Make it a hot grill summer at Whole Foods Market.
My episode today is a little different. I usually talk about things that affect the health of individual kids and families, but I heard this story from a mom last week, and it makes me want to talk today about keeping an entire community healthy. Here's the story. I have the privilege of taking care of this amazing family. The couple adopted their niece and their 2 nephews, who were all under the age of 4 when they took them in. The kids had a really rough start to life, and they are honestly just thriving now. These are the best parents, and I have watched them in clinic interact with these kids. They are fantastic. So their mom brought them into the clinic last week because they were all coughing and sneezing, but they didn't seem particularly sick. And they had been coming home from elementary school every day for the past 2 weeks, absolutely covered in black soot. Their mother said she had to scrub them clean every night. And then she showed me their socks. So she pulled these white socks out of her bag, and the socks were white where the shoes were covered, but there was a line above there, and the socks were absolutely black. She was right. Then she showed me a video of the playground, and right next to the elementary school playground fence was a huge construction project that was breaking up asphalt. So she asked me if I thought the kids coughing and sneezing could be from the asphalt dust. I'm so glad she asked me this because it is a health issue. However, I don't really know anything about the health effects of asphalt dust. I quickly looked into it, I just Googled it, and easily confirmed that yes, the construction is very likely the cause of these kids sneezing and coughing. Now, the bigger issue. What can be done about this? School doesn't end for 2 months. There's no way she can pull them out of school. Obviously, this is not an easy fix. And I'm talking about it today because every one of us at some point is going to have an experience like this. We will encounter an issue that affects a large group of people. And in my field, we call this community pediatrics. And there are pediatricians that specialize in this field. In this episode, I'm going to talk with Dr. Nancy Graff, who has spent her career advocating for children. We're going to talk about the specific and easy actions we can all take, things we can all do to create a healthy community for all kids. I'm Dr. Wendy Hunter, and I'm the pediatrician next door. I'm that doctor friend you call for practical advice about your kids' health. I mix the science of medicine with the reality of parenting. There are many health and human service agencies that can help with this issue of environmental exposure at this elementary school. But finding the right one is tough. I suggested to this mother that she start by calling 211. That's the phone number you call for help finding any community service. The operators at 211 maintain a database and can refer and connect anybody in need of literally anything, like daycare referrals, free dental help, legal services, housing issues, food pantries. If you encounter an issue in your community and you're not sure where to start by calling 211. This isn't going to be an easy fix for this mother, and I suspect that as she digs deeper, she's going to end up caught in a web of local politics, state regulations, economic issues, who knows. And all she wants is for her kids to go to school and not be exposed to potential toxins. There's a lot to know about how to provide a healthy community for kids, and there are doctors who specialize in this. One of my favorite community pediatricians is Dr. Nancy Graff. She is a professor at the University of California at San Diego, and she has spent her entire career advocating for foster youth, working with child welfare services, and advocating for legislative changes to improve children's health. First, I asked her to explain community pediatrics.
So community pediatrics is looking at the child within the context of where they live. So that context is their family, the neighborhood they live in, the school they attend or preschool they attend, and looking at what you can do in that environment to make them healthier. So maybe they live in Barrio Logan and there are trucks driving by every day because they all drive down Harbor Drive and they're polluting the air. And that's where the kids' park is. So it's hard to be healthy when that's the air you're breathing in. And we'll find that kids who live in that area have a much higher incidence of asthma. So if you want to help those kids with their asthma, you can't just treat their asthma. You need to treat their community in order to make them healthier.
So we hear a lot about the physical environment. There's a lot in the news about, environmental exposures, lead, mold. And then obviously there's a ton of talk right now about mental health and guns and vaccines and how those things impact kids' health. I don't think a lot of people understand the effects on kids' health from things like poor quality housing and lack of playgrounds. So what are some of the things you've experienced in terms of what people refer to as built environments on kids' health?
So it's some of the same things that you mentioned. Is there a playground that's safe for them to go to? Do they have a way to get there? The first time it kind of dawned on me, which was a long time ago, I was talking to a mom whose kids were small, like young, but overweight. And it's like, how much do they play outside? What can we do for that? And she's like, there's no park near us. There's no safe place for them to play. I don't have a yard. We can't get there. So how do we expect kids to be active and get healthier when they don't have access to that? We also talk a lot about things like food deserts. And that means we need to have neighborhoods where there's easy access to food. There are neighborhoods in San Diego where for a long time there was no supermarket that was easy to get to. So of course people didn't have fresh food or healthy food. You would look at these moms who would have to get on a bus with their toddler in tow where you can't take a stroller on and do a couple changes to get to a store where they could buy food, to a regular grocery store. And that just was not tenable for them. So we need to have markets. We need to have access to farmers markets and things like that. And I think that's a lot of interventions that people can get behind and that people can be active in.
I had a similar humbling experience when I was giving a community talk at an apartment complex. In my clinic, I'm always harping on kids about eating healthy snacks and blah, blah, blah. And I noticed as I drove to give the talk, there were no grocery stores nearby. I was looking for a cup of coffee, couldn't find anything. So I walked to the community room, and as I was going over there, I passed an open apartment door where an older woman was sitting with a little fold-up table, and she was selling Skittles and spicy chips. So I asked her about this, and she said that's how she makes money. Her son brings her stuff from Costco every 2 weeks, and she sells it from her front door. And I realized that for many of these kids, this is their only access to an after-school snack. And there isn't anything I can say in clinic that's going to help these kids get like an apple and peanut butter after school. So this is where the only treatment is going to be through advocacy. And there are a number of things that have been done to make it enticing for neighborhoods to be able to bring in grocery stores with fresh foods. For example, Dr. Graff shared this with me about advocacy.
Advocacy can entail a lot of different things, but it's really kind of arguing on behalf of a issue, position, or a patient. It can be on the individual level. So we do that all the time as doctors when we advocate for a child to get certain treatment at school or preferential seating if they have their hard of hearing or whatever it is. It could be more on the kind of local and community level, as we mentioned before, with bringing in a farmer's market, or you can do it more on the governmental level, whether that's city, county, or state level, and get involved in legislation. As they say, all politics is local, and it really does start that way.
I was really surprised in the very little amount of advocacy that I've done, that when I've met with legislators, that even if it was a topic that I didn't feel like I was an expert on, I was absolutely the expert in the room on any topic I was passionate about. Because when I've gone and talked to my local senator or my local congressman and explained to them something I was passionate about, they have never had any idea. So, for example, I went into a local legislator's office to explain to them that we needed to vote for a particular law that would allow us to give vaccines to kids from different insurances. So we have to keep a different refrigerator in our office for patients who get vaccines from Medi-Cal versus vaccines from private insurance. They're the identical vaccines, but if we run out of one, we can't give it even though we have it in the other refrigerator. And so that was a topic that I went and I advocated for. And when I talked to our legislators about it, they had absolutely no idea that that was something that was happening in my life and that I cared about and was something that they could easily fix.
And representatives are responsive to constituents. I know we don't think they are, but they actually are. Especially either like your kind of city council, your county people, and the state people. They don't hear a lot from people unless it's a really contentious issue. So, when you think of guns or something like that, that's a fairly contentious issue most places. And so they'll get a lot of traffic. But if you are calling about something else or contacting them about something else, whether it's lead in the water or whatever you're passionate about, they don't get a lot of information. Like for us as doctors, when we go in and talk to an elected official, we know more about health than they do, with the very rare exception of doctors who are in the legislature, which is not very common. And so they're not going to know anything other than their own experience walking into a doctor's office. So when you look at them, most of them are lawyers, not all of them, but a lot of them are lawyers. And so that's what they're going to know about. And the same is true for your parents out there. So you bring your own lived experience, and that's what you know about. So you know what it's like to raise kids in whatever environment you live in and you work in. And so that's the experience that you bring and the expertise.
If you have an issue or a problem that affects the community, it's easier than you think and often effective to involve your local representatives. The mom with the elementary school asphalt problem started by talking to the school, and they did absolutely nothing. Then she went to the school district, and they just gave her proof that the company had done an environmental impact statement before starting construction. So now the construction company is using hoses to keep the dust down with water, and they did conveniently take a break during the family picnic. But they are still working every day, and there's still dust raining from the air. So this mother's next step is going to be to go to the city environmental department, and she's going to need to involve her local representatives as well. As Dr. Graff and I have both said, elected officials know a little bit about a lot of things, and they rely on us to be their experts and their ears and their eyes in the community. I know it can sound intimidating to meet with them, and you might rather write a letter or an email or even give a call or leave a voice message, but meeting in person is very effective and is way less scary than you would think. Most of the time, you will be scheduled to meet with someone on your legislator's staff and not actually with the congressman or senator.
A lot of times you'll talk to a staffer or you'll meet with a staffer, but they're the people who usually know what's going on. So the elected official has to know a little bit about everything. They're kind of like a generalist, so they have to take care of prisons and schools and roads and kind of everything. But they'll have staffers who, there's a health staffer, and that's the person who knows the most about health and the health bills. And so talking to that person actually is sometimes more helpful because they'll understand what you're talking about.
That was my favorite thing about the first time I got involved in advocacy. And I was so nervous and didn't want to go to the office. And then I met with the staffer, and they were like 22 years old. And
yes,
we're very open to hear anything I wanted to share.
Yes, that frequently happens, but they still have the ear of the elected official. But if you can tell them, you're going to educate them, whatever topic it is that you bring up.
Host the ultimate backyard barbecue with Whole Foods Market. It's the hot grill summer event through July 16th with sizzling sales on no antibiotics ever boneless beef ribeye steak and beef New York strip steak. Plus, check out sales on sustainable wild-caught Alaska sockeye salmon, organic strawberries, and more. In a hurry? Choose grab-and-go favorites like picnic salads and sushi. plus plenty of cooler-friendly beverages. Make it a hot girl summer at Whole Foods Market.
Your brain needs support, and new Ollie Brainy Chews are a delightful way to take care of your cognitive health. Made with scientifically backed ingredients like Thai ginger, L-theanine, and caffeine, Brainy Chews support healthy brain function and help you find your focus, stay chill, or get energized. Be kind to your mind and get these nootropic chews at ollie.com. That's OLLY.com. These statements have not been evaluated by the Food and Drug Administration. This product is not intended to diagnose, treat, cure, or prevent any disease.
If you're struggling to lose weight, you've probably heard about weight loss medications like Wegovy or Zepbound, and you might be wondering if they're right for you. Meet PlushCare, a leading telehealth provider with doctors who are there for you day and night to partner with you in your weight loss journey. If you qualify, they can safely prescribe you medication from the comfort of your own home. To get started, visit plushcare.com/weightloss. That's plushcare.com/weightloss. plushcare.com/weightloss.
I started my career working in a pediatric emergency department, and I put a lot of Band-Aids on kids, so to speak. I learned pretty quickly that stitching up a wound or giving antibiotics for pneumonia fixed kids' immediate problem, but many of my patients were going home to unhealthy environments, and that is just as important to fix. There was one kid who I saw 3 times, 3 nights in a row in the emergency department. His father gave me a list of symptoms, and I did lab tests and imaging, and I could not find anything wrong with this kid. The father begged me to keep him in the hospital. And then on the 3rd night, as I was leaving my shift at 3 o'clock in the morning, I saw the boy asleep on the chairs in the hospital lobby, and his dad was pulling food out of the trash can to feed him. He took out some McDonald's hamburger buns and put some Fritos in between the layers. I don't need to explain how I felt. Of course, this stuck with me. The weird thing is that 8 years later, the same kid came into the ER. He was 12 now. He had been picked up by the police for shoplifting in a grocery store. And I can't remember why the police brought him to the emergency room. I remember he was combative, but I think maybe he was wheezing or something also. He had been in a few foster homes, and the officers couldn't contact anyone to find out who was caring for him at this point. Once he got into an exam room and he was given a dinner tray, he was honestly happy and cooperative and wonderful. And that was the moment when I realized it is my job to advocate for kids. It's everyone's responsibility to help create an environment where this doesn't happen. And I should have seen it coming. I failed that kid. We all failed that kid. I don't even know if there are resources in our community that could have helped him along the way. I suspect there are. Dr. Graff has done a lot of work with foster youth, and it's interesting to talk with her about this because it's really a hidden issue. There are close to 400,000 kids in foster care in the United States, so you probably know one. The outcomes among kids in foster care are pretty startling, and it's an issue that carries long-term effects.
Foster youth, as they age out, 7 out of 10 foster youth, so those who turn 18 and they're still in foster care, 7 out of 10 young women who age out of foster care will have children by the age of 21. Only 3% of former foster youth who age out of the system graduate from college, and we know what that means for your earning potential. 25% of them will be homeless by the time they're 21 for at least some period of time. About 20% of them will be incarcerated by the age of 21. They have the highest rates of PTSD of any population, about 25%. So whatever we can do to support them on their journey and on that transition is really going to be helpful to them.
There are many fantastic programs out there that address the root causes of child health issues, and they can use your help. Any time or materials that you can give are going to help. So, where do these programs come from? Some of them are part of a nonprofit group that raises money through donations to do their good work. And much of that money comes from grants from the state or federal government. And some of these programs are created through legislation. That means there's a bill that is passed that creates the program and provides funding from the state or the federal government. All legislation starts as an idea. Ideas can come from anybody, and the process begins when either a person like you or a group persuades a member of the legislature to write a bill. The bill then bounces around between different committees. For example, if it needs financing, it will go through a fiscal committee, and then it's voted on at different stages by the Senate, the Assembly, or the House, depending on whether the bill is at the state or federal level. And your representatives vote on these bills. They want to know if their constituents, which is you, support the bill or not. So you need to call them and tell them. Just a few days ago on Instagram, of all places, I saw a post asking for support on 2 different bills. And normally I ignore these pleas, but they do matter. So now when I see something like that, I pause and I at least look to see if it's something that I might care about. There were a remarkable number of bills in the last legislative session related to supporting foster youth. And that's largely because it's an area where just a small amount of effort makes a huge impact on not just the individual child, but it's also going to change our community. Addressing the root cause of issues is where we want to put our advocacy efforts. And that's where we want to spend our time when we choose to volunteer in the community. For this reason, Dr. Graff has long worked on a lot of bills supporting foster youth. And the other area that surprisingly takes very little intervention to have a big impact on the health of everyone in our community is dental health. It took community effort and government action to improve everyone's teeth. First, public water had fluoride added to it, which has made a huge difference. And then second, public health officials made a coordinated effort to get the word out about how to take care of kids' teeth. So I asked Dr. Graff about this. I asked why it matters and what we can do to help.
It's a huge issue. I always say that a healthy body begins with a healthy smile. Cavities is the most common chronic disease of childhood. Half of kids in California have had dental decay by the time they enter kindergarten. And by the time you reach adulthood, the majority of people, 80 to 90% of people, have had some sort of dental decay or dental disease. It costs a lot of money to take care of people with cavities, especially young children. They're not very cooperative. So if they need care when they're 2 or 3 years old, they need to have anesthesia to have that care done. So it's very expensive. It's very painful. Kids in California miss more than 800,000 school days every year because of dental disease. Either they're in too much pain or they have to miss to go to a dentist or something like that. Dental disease is also associated with poor health in the rest of your body. So there's been a strong body of research now that shows that people who have dental disease at a younger age, whether that's cavities or gingivitis or periodontitis, are more likely to have cardiovascular disease as adults. So if we can get people to have healthier teeth when they're young, that's really important. The other thing that I think we don't really think about is self-esteem. Kids who have rotten teeth are less likely to raise their hands in school and less likely to want to be socially interactive. The first thing that you see usually when you meet somebody is their smile.
Once the negative effects of poor dental health were recognized, communities have made a lot of progress improving kids' oral health. And that's going to pay dividends in terms of lower health costs as this generation gets older. Part of creating a healthy environment for kids is also anticipating emerging new problems. I asked Dr. Graff what she thinks are the next biggest health issues facing kids today that could benefit from us taking action on a community level.
One of our biggest issues is mental health. I think we've all seen that as pediatricians. The pandemic was a big hit. Kids didn't have the capacity to deal with all of a sudden not being in school, not being able to socialize, trying to learn on this screen and not being able to pay attention. Some kids didn't have screens to learn on. A lot of kids dropped out. And we've seen that much higher incidence of anxiety and depression, and the mental health system is overwhelmed. People who you think would have access don't have access. So people who have good insurance can't find mental health services. And then if you don't have good insurance, if you have Medicaid, it's even that much harder. So how do we build capacity within school systems to be able to address that, to have more mental health services in schools, and just more access to mental health services overall? And I think that's going to be a long-term process for us and a long-term issue for us.
This is the area where you're going to see the most number of new bills at both the state level and at the federal level. If access to mental health services is something that you think might affect your family and your neighbors, it's going to be important to help find solutions to this problem. Find out if your representatives talk about mental health or kids' health in general by looking at their website. Listen when you hear people talking about mental health services at your school or in your community, because some of these programs are terrible. They're expensive and inefficient, and some of them are fantastic and helpful, and it's your role to help guide where our money is spent on this issue. If you're a parent or a grandparent, remember, you are more of an expert than most. And one other way you can help is through volunteering. And Dr. Graff talks about mentoring as well.
Big brothers, big sisters. Again, that's kind of the mentoring approach. That's been a long studied program that's been very successful. And so maybe you can't take in a foster youth. Maybe that's not your capacity. But if you have extra time and you could be that mentor for somebody through like Big Brothers, Big Sisters or some program like that, huge impact on a child's life.
Every one of us is already doing something that has a positive effect on the health of other kids. If you're coaching a sports team or donating clothes and toys, you're probably doing more for another person than you even know. But just raising a child who goes to school and is nice to another kid, that's contributing to a healthy community. Okay, there's one last thing you can do, and here it is.
If you're going to pick one thing to do for advocacy, it would be to vote. It's not hard. Even if you don't know all the issues, at least vote for your elected officials. It doesn't take long to click on their website and figure out if it's somebody you agree with or not. It's really important. One of my other favorite quotes is, bad elected officials are put in office by good people who do not vote.
On most episodes of this show, I talk about how to take care of the health of your family or an individual child. And yes, we can parent our own children, but we also have a responsibility and an ability to speak up to protect all children when we see something or experience something with a child that, if it were changed, could affect many kids. Like if your child is being bullied or has a bad teacher, a lot of parents will just move their kid to a new school. The alternative is that a parent can try to identify the cause of the problem and change it. I challenge you to take one single action, no matter how small, that elevates the health of your community for all kids. Send me a message and let me know what you did. You can message me on Instagram at the Pediatrician Next Door. And be sure to subscribe to the show. Maybe I'll share your story on a future episode. For more from the Pediatrician Next Door, find me on the web at pediatriciannextdoorpodcast.com. If you've got a question about the weird things kids do, send an email to hello@pediatriciannextdoorpodcast.com for a chance to hear your voice on the show. I'm Dr. Wendy Hunter, and I'm the Pediatrician Next Door. This show is produced by Red Rock Music. Make sure to subscribe and leave a review wherever it is you're listening. I'll be back next time with more.